Hi everybody, my name is Svetlana Lisovsky. I'm a practitioner at UP Medical, Austin, Texas, where functional medicine root causes practice. I want to welcome you to Diane.
Hello.
Diane, you came to us in August of 2021. What made you call us?
I was suffering from a really bad skin infection, or I didn't know what it was. I had, for years, I had been battling this. It first occurred when I was about 30, and I'm 66 now, so you could see that it's been a long time. It used to be intermittent, and once or twice a year, my skin would just start to become really inflamed, and I'd get really pussy sores on my face, and they would scab, and my feet, my legs, I had a lot of problem with itching, and it would keep me up at night. So I had been making the rounds with different doctors for many years, and as I was getting older, I had thyroid cancer, and I'm sure that affected my immune system, because after that I was fine for a couple of years, but then I started to have more and more of these skin eruptions. And by the time I came to Svetlana, I didn't even come to seek treatment. I came with my daughter who was seeing Svetlana, and she told me she could help me, and I really, at that point in my life, I had lost hope. I was resigned to the fact that I was just gonna die with these sores on my body, and that's how I came to root causes.
How did it affect your daily life?
Well, I was, first of all, I was ashamed. I had a lot of shame about my appearance, and I didn't know if I was contagious, and I felt like I couldn't work. In fact, I felt like I couldn't work because of my appearance. I had scabs all over my face, and aside from that, when it's inflamed, I am itching so bad. I couldn't concentrate, and kept me up at night, so I wasn't rested, and I would actually appear to be so distracted. I couldn't concentrate, and I didn't really think any company would want me as the first person to represent their company, or a facial representation for their company, as well as I wasn't very strong, and I wasn't able to guarantee that I could show up in any kind of reasonable condition. I never knew from day to day how bad it was going to be, and I stopped exercising, I stopped going out, I stopped doing things that I liked that involved other people, and I was very depressed, and I had no hope by the time I came here. I had no hope for quite a while, and just was not making any progress, didn't think progress could be made.
Right. What have you tried before you came to us?
Oh, you name it, I've tried it. I had every part of my body tested, biopsied, and all the standard tests. My blood work was normal. On paper, I was normal. I had a skin bolus or infection on my jaw that I'd had for years, and nobody knew how to get rid of it. It would spread, and it would get bigger and smaller, and it was painful, and it would change colors. So, and yet a skin biopsy revealed nothing wrong with it. So,
have you tried any treatments?
Oh yes, well, you should see my medicine cabinet. I tried everything. Alcohol, hydrogen peroxide, witch hazel, tiger balm, like you name it. You can Benadryl, Vicks Vapor Rub. I tried sauna, I tried steam, I tried swimming, I tried bleach baths. I just tried all kinds of treatments and was not making any progress. And
have you tried prescription treatments?
Oh yes, in fact when I came to you, I was on doxycycline, an antibiotic that I was taking every day, and I didn't think it was good to be taking, and this was the plan for me to be taking this antibiotic for the rest of my life to keep my skin under control, but it wasn't working. What it did was it minimized the infection if I was ever scratching or got infected, but that's not a solution. It was just treating the outside result of something really wrong.
Correct.
So I was.
So after our first appointment, I collected very thorough history, all your health journey, and based on your symptoms, we agreed on series of testing to find out the root cause of your illness. Can you tell me how did it go? I mean, was it difficult to do this testing? Any obstacles with this testing?
The testing was actually surprising to me. Svetlana, from the very beginning, I think, suspected a mold infection or mold exposure, as well as we didn't know, but it looked like my body had like toxic overload. And it was interesting for me to read that you detox through your feet as well. I mean, because I had a lot of problems with my feet. So we, first of all, we had the house tested for mold. Then we had me tested with just my basic blood work, and also vitamin and mineral deficiency. Then we tested for body inflammation or any kind of dysbiosis or not bacterial infection, was that?
Bacterial imbalance.
And I came up really high in that. And I didn't think I had any bacteria in my body, so that was very revealing. Svetlana had me get an MRI for the fact that I have lost my sense of taste and smell, so we ruled out that could be any kind of tumor. Everybody likes to know that they don't have a brain tumor. But we didn't. I love Svetlana because there's nothing that raised her eyebrows. She would nod her head, and she never looked at me like I was out of line. She would entertain any suggestion I had. She would give it consideration. So the best thing about working with Svetlana has been that really we are a team, and I value her experience. She values my personal experience. So between us, we've really made some just incredible changes in my life, and for the better.
I believe that patients know their body the best.
Thank you for that.
When a provider can listen what patient says and validate what patient thinks, adding personal knowledge can make tremendous progress in diagnosis.
I value that tremendously. Nothing's worse than being dismissed by a doctor that can't be possible.
Right. Everything is possible. It's impossible if you don't know it. And if you don't know it, we can't know everything. You research it and you find out the answer.
Exactly.
And I don't stop until I find out what's wrong.
That's a nice change from most medical doctors.
So based on your testing, so we found that you had significant imbalance in microflora, you had toxic overload, you had some nutritional deficiencies and inflammation. And based on all those results, I prescribed supplements, and you also worked with our nutritionist to implement nutritional plan. How did it work for you?
Well, it was a lot of changes, and we went through phases where first assessing what the problems were, then killing off anything that was weakening my system, and refortifying me where I was weak. So there was a lot of vitamin supplementation, and balancing the gut, and it was a real eye-opener for me that what to me was a skin problem actually turned out to be a gut problem. And I had no idea when I came here that was the problem. But I came here with scabs on my face and no clue what was causing them. And my skin would change colors throughout the day, with green under my chin, all around my neck. And my friends would comment on it, "You don't look well." That was really the comment I got the most, "You don't look well." And so so every time I would meet with Svetlana, we'd be in a different phase, and then I would meet with the nutritionist, and she would talk to me about how I would implement some of these changes, and we'd go over exactly what I should be taking and what I should be avoiding. We examined my diet, and I worked with Aidan DeWitt, who was very knowledgeable, and Paige Britton, both on staff here, and they were wonderful. Nothing worse than going to a nutritionist who says they want you to totally revamp your living plan or your diet. that could be expensive, it could be discouraging, it could be difficult, and it could bring out resistance in people. So I didn't even have to deal with that. Both of them asked things like, what is your normal diet? And I myself eat a lot of nuts, and so Aiden sat down and she said, okay, you're low in zinc. We need to fortify you with zinc. So of all the nuts, the highest nut that has zinc, or the nut that's the highest in zinc, is pistachios. So now when I want nuts, I need pistachio nuts. So things like that. She was well within my understanding and my capabilities. She wanted me to increase. I was low in vitamin A, and not only was I supplementing with vitamin A capsules, but she wanted me to make sure. She said, ideally, you don't have to take supplements for the rest of your life. We will be able to we will bring you up to speed with your deficiencies, and you can start to, you can begin to learn to address any potential deficiency with your diet. So for me, salmon became a big change, and I eat salmon every week. Aiden would probably like me to say I eat it 3 times a week, but I don't always eat it that much. But I thought if any fish would be fine, and it turns out that some tuna is quite toxic. So, I learned a lot about how to shop at the grocery store, what to read, and totally affordable ways to supplement my diet. And I think my normal skin is starting to show now. I don't think people look at me and think you look ill.
You look healthy.
I look normal, so it's a very big change.
So it has been 9 months since you came here and we started to work together.
Mm-hmm.
So you feel better?
I feel much better, but the progress was not immediate. And so I'm doing these treatments, the supplements, these tests, and I love that Svetlana never thought that anything was, she never ruled out any possibility. So I'd come here with another idea, and she'd say we would consider everything together. And the progress was not immediate. But for one thing, I stopped getting worse. And that was a big change right in itself, because I had been steadily getting worse. Over the years as I got older, and then after cancer surgery, then I guess my immune system was gradually becoming weaker. And I think the problem had been going on for a lot longer than I thought. I thought it was pretty recent, and I would have sworn it was a skin problem. So it was really news to me that it was a gut problem. And once we started to heal the gut, we had to assess it, and then we had to heal it. And I've made steady progress, and it's only been in the last 2 months that I have had almost no itching at all. Itching was my biggest symptom, and I start to itch along my hairline and my skin, all around my hair, my feet, my body. It would get worse, and I thought, I just would withdraw, and I thought, but what happens now is I have a protocol to address that, and I think now I don't think I need to put something on my skin. Now I think I need to really think about what I'm eating. I need to think about my resting, my supplements, am I on top of all the things that I need to do to keep my gut healthy. My skin detoxes my gut. So
there is no better reward for a practitioner to hear that patient feels so much better. That makes out my day.
You told me you could heal me, and you have.
I did.
And we're not even done yet, because as Svetlana pointed out, I have been very sick at some level in my gut for quite a long time.
Yeah.
This started when I was about 35. I had my first outbreak, and it'd be once or twice a year. And then over the years, it became once or twice a month. And then by the time I saw you, it was never, ever, it wasn't going away. So.
And we know that it takes, and from the experience, that it takes about 1 month per year of being sick to get you well.
Right.
So if you were sick for 30 years, expect that healing will take at least 30 months, if not more.
And even though I feel much better now, Svetlana is right. She said, you were so sick for so long. It may take you. It'll take you at least a year, and it may take you 2. So that actually didn't discourage me. That is a treatment plan that I can do that. And I'm seeing slow, steady progress, and I know I'm facing the solution instead of having the problem and digging my heels in. to endure it. So you were good for your word. You said I can help you, and you are helping me.
I kept my word. Can you tell me, what was the difference in your experience here at UP Medical with me versus providers that you met before you came to us?
It's a common word, a popular word right now. But we collaborated. That's the best way to put it. I would come in, I come in and show you, this is what I'm doing now. I'm trying these, and this cream really works, and this lotion really works, and what do you think about? Should I take this supplement? So when I first came, I would tell Svetlana every weird thing that was going on with my body because I didn't know what was relevant. I was bumping into things. I didn't know if my proximity sense was affected or my sense of taste or smell was related. My feet were itching. Did I have athlete's foot? Was that related? And turned out to be probably toxin release or all of it. Now I don't look at it as my feet are sick. I look at it, my body is healing and it's detoxing through my feet. So I look at it completely differently. And Svetlana never threw me out. She never said, you're too excitable, I can't deal with you. She just said, what else? And we'd work together, we'd try new things. She would rule nothing out. And I had many doctors just say, that's impossible. It can't be that. Your skin doesn't do that. Yes.
Have you heard that? It's all
not only it's all in your head, but kind of hinting that I was delusional. I mean, look at me. I was so sick. And one doctor said, I won't treat you until you stop taking drugs. And I said, I'm not taking drugs. So it's like, what? I'm a rational human being. I'm an educated person. And I came with list of symptoms, for years and years I was logging it because I didn't know what would help me find the solution. So
what a journey.
It really, and I got help all along the way. Once I got into the field of functional doctors, all kinds of coffee enemas. I never thought of anything like that, or I never thought of saunas, or there's so many things I tried.
Right.
And now I see what's helpful to my body, and now what I see what is curing my body. What's helpful is topical, and what's curing is really much deeper.
Okay. So here it's at UP Medical, we treat root causes of illness. We see patients virtually and in person, and if you've been struggling, looking for answers for your illness, come here and we'll help. Thank you.
And get well.